We are about to embark on a journey inside the body, deep into our arteries. Our mission is to find a killer, one whose work can start while its victims are still in early adulthood, and the diseases it causes are the leading cause of illness and death in the United States. This killer is atherosclerosis. Some people may not have heard of atherosclerosis, but the risk factors that contribute to it may be familiar and include obesity, elevated blood pressure, diabetes, a family history of heart disease, high cholesterol, or simply growing older. All affect our arteries. Some things we can change, like stopping smoking or changing what we eat, while others, like our family history or our age, we can't. But we can all take steps to reduce our risk of suffering a heart attack or a stroke by improving the health of our arteries. To understand how we can improve the health of our arteries, we will need to take a closer look. So sit back, relax, and enjoy. We are now in an artery, traveling with red blood cells that carry oxygen to major organs throughout the body. And this is cholesterol. You may have heard of cholesterol, but did you know there are different types? The most important are LDL cholesterol, known as the bad cholesterol, because it can lead to clogged arteries, and HDL cholesterol, called good cholesterol, because it is believed to help remove cholesterol from the body. Generally, our aim is to keep good cholesterol levels high and bad cholesterol levels low. When there is too much bad cholesterol in the blood, this can cause serious problems. When there is damage to the lining of the artery caused by, for example, high blood pressure, LDL cholesterol is more likely to enter the wall of the artery. When LDL or bad cholesterol enters the damaged wall of the artery, it changes and can lead to inflammation. Over time, inflammation in the artery wall creates something known as a plaque. Plaques can start forming at an early age, and over time this can lead to clogging of the arteries. This can happen in a number of different sites around the body and can get progressively worse over time. This chronic process, known as atherosclerosis, can become life-threatening depending on whether the plaque is stable or unstable. A stable plaque can continue to grow, slowly reducing blood flow over time by hardening and narrowing the artery, but does not necessarily completely block the flow of blood. But sometimes even a small plaque can become unstable and rupture, exposing its contents. This is much more dangerous than a stable plaque, because a clot can quickly form, completely blocking the flow of blood. As stable plaques form and cause narrowing and hardening of the arteries in the legs, the blood flow is restricted, sometimes making it painful to walk. Elsewhere in the body, the effects of plaque rupture can be immediate. A blockage in arteries supplying blood to the heart can cause a heart attack. A blockage in arteries supplying blood to the brain can cause a stroke. So what can we do to help maintain healthy arteries? Addressing our risk factors will benefit our general health and the health of our arteries. We can stop smoking, change our diet, exercise more. With the help of your doctor, you can manage other conditions that may affect your arteries. Of course, some things, like your age or your family medical history, you can't change. If you were concerned about atherosclerosis and the health of your arteries, talk to your doctor about having your blood pressure, blood sugar, and levels of good and bad cholesterol checked. If you've seen your doctor and are being treated, continue to follow your doctor's instructions. Us Against Athero, brought to you by AstraZeneca, is a movement to spread national awareness of atherosclerosis and improve the knowledge they need to improve the health of their arteries. For more information or to share this program with someone you care about, please visit www.athero.com. Thank you for joining us. Please watch your step as you exit the simulator.
Here's a common finding that I thought would be nice to document, if only for patient education purposes. Here's an eye, and you can see here along the eyelid margin these little white dots. These are actually the orifices to the meibomian glands. The meibomian glands produce oil, which is an important component to the tear film because that oil keeps the tears from evaporating too quickly. Now normally when I push on it like this with a Q-tip, clear oil comes out. But here you can see right at this spot and this spot, it's coming out not clear, but more like toothpaste, kind of white colored. This isn't normal. These meibomian glands are inflamed, and because of that, the patient's having a lot of irritation because their tears are evaporating too quickly because this oil is not working well.
During a 3-month period, out of 363 patients, only 232, 130 male and 102 females, suffering from meibomian gland dysfunction of different intensity, submitted blood for lipid profile. As foreseen, the nationalities of the patients differed. Patients from East Asia, including India, Pakistan, and Bangladesh, were the greater majority at 32%. Second came in patients from Africa at 21%. Countries such as Egypt and Sudan were the leaders in that group. Funny enough, patients from the Arabian Peninsula and the Middle East came in third and were similar in quantity at 19%. Islanders from Philippines, Sri Lanka, and Indonesia made up 8%, and at 1%, Western Asians from Poland and Ukraine completed the group. Taking into consideration that meibomian gland dysfunction had different intensity in different patients, the results showed that only 30% of the patients had normal levels of LDL under 100 mg per deciliter, whereas the majority was above the normal value, and an alarming 26% had LDL levels over 140 mg per deciliter. As you can see on the graph presented, the male to female results also differed. 40% of women showed a low LDL level of under 100, and only 16% had levels of LDL above 140. On the other hand, the male results showed the contrary, with 35% having levels higher than 140 and only 21% maintaining their LDL levels under 100 mg per deciliter. Eastern Asians' results were evenly distributed. 74% had levels over 100 mg per deciliter, of which 28% were above 140. Arabs were the only group that had the least LDL levels, with only 9% over 140 and 48% under 100 mg per deciliter. The results of Africans and Middle Easterns were also evenly distributed, with 28 and 31% over 140 mg per deciliter accordingly. The alarming finding is that 78% of islanders had levels of LDL over 100, with 47% over 140 mg per deciliter. Finally, both Western Asians had levels over 120 mg per deciliter. Based upon the results of this clinical research, the following conclusions can be made. Meibomian gland dysfunction might just be an indicator of LDL elevation. Early detection of high LDL and its control can save the patient from its complications. The human body is whole. The smaller the affected organ is, the earlier it helps us detect problems of the whole body.
Whether you're in the 18% of Americans with high cholesterol or not, you can benefit from living a low cholesterol lifestyle.
A low cholesterol lifestyle involves making conscious decisions to eat, play, and live in a way that will help to lower your levels of harmful LDL cholesterol. Cholesterol is a fatty substance that's found in the body. Some cholesterol is necessary for basic functions, but here's the catch. The body usually makes all the cholesterol it needs. With this in mind, it makes sense to lower your intake of fats. In fact, it's best to limit total fat intake to less than 30% of your daily calories. All fats aren't created equal, though, and fall into different categories: saturated, unsaturated, and trans fatty acids. Saturated fat is found primarily in foods from animals, like beef, eggs, milk, and cheese. Because saturated fat is the main dietary cause of high blood cholesterol, it's best to limit it to less than 7% of your daily calories. The unsaturated fats are found in many fish, nuts, seeds, and plant oils. They should make up about half of your daily fat intake. Perhaps the worst fats are trans fatty acids and hydrogenated fats. Trace amounts of these are found in animal products. They're also formed during the process of hydrogenation, which is how margarine, shortening, and cooking oils are made. Understanding and limiting your intake of fats is an important step toward a cholesterol-friendly diet, but it's essential to increase your fiber too. Consuming 25 to 30 milligrams of fiber-rich foods like fruits, vegetables, and whole grains daily can help lower LDL cholesterol. A healthier diet is a great start, and exercise can make your program even more efficient. Aim for 30 minutes at least 3 times a week. While physical activity is not known to impact bad LDL cholesterol, it the risk of heart disease. And finally, one of the most important things you can do to lower your cholesterol levels is to stop smoking, or to decrease the amount of time you spend around smokers. Smoking is a double blow. It lowers levels of HDL cholesterol and makes your body resistant to heart-healthy exercise. High LDL cholesterol is bad news, but lowering your cholesterol can help. Remember to see your doctor before you begin a new exercise or diet program.
وما أصابكم من مصيبة فبما كسبت أيديكم ويعفو عن كثير